This is Katie Brown and Emily Clark, and today we're going to be talking about the occupational therapy assistant. So what is an OTA? An occupational therapy assistant is somebody that works under the supervision of an occupational therapist. OTAs help patients that have either had an injury or a surgery or some type of disorder or disease, and they basically help to rehab them back to being able to do everyday skills, daily activities, things like that. The main goal of an OTA is to return their patient back to the same functioning level that they were at before their injury happened.
So their work environments. The number one work environment that you're going to find an OTA in is a nursing home. The second place is going to be like your privately owned practices of an OT in their offices. And then the third place, you're going to find them in hospitals. No matter what work environment that an OTA is in, they're going to be spending lots of time on their feet. They're going to be interacting with patients. They're going to be interacting with all of their coworkers, paperwork. They're going to be moving at all times of the day.
So the typical day of an OTA that works in a nursing home would be they show up to work, they're basically getting ready for work. They're going to have some new patients that day, maybe some returning patients that they've been working with for a while. Because they're working in a nursing home and they have older patients and residents, they'll most likely be dealing with fall victims, people with Parkinson's or Alzheimer's, and anybody that is unable to perform these daily activities or needs help with these activities. So throughout the day, an OTA will work under the OT supervision. They'll also work by themselves, helping the resident or their patient, however they need to assist them and help them regain that strength and that independence in their life by being able to do things on their own. So usually their rehabilitation techniques includes upper body strength. It can also include walking and helping patients relearn to walk or walk better so they're not tripping over themselves. But it's usually upper body strength so that residents are allowed to shower, brush their teeth, daily activities, do them every day by themselves, because the OTA's goal is that the rest of these people's lives will be able to be independent and be fulfilled and be able to do things on their own.
So the main question, why does an OTA need psychology background? Well, you're going to need to know the knowledge of human behavior just in general, not only to interact with your patients, but to know how to actually respond to how they react. You're also going to need to know the abilities, the personalities, and all the interests of your patients you're working with. No matter if they're younger or if they're older, you're going to have a wide variety of different personalities, interests, and abilities that they're all able to have. One of the biggest things probably is how learning and motivation work, how that ties in with your psychological processes, because that's going to be a number one part of when they go in for rehabilitation. Really, rehabilitation isn't only the physical portion, but you are a lot of mental. Another reason you're going to need it is the assessment and treatment of behavior disorders. So maybe you'll have a patient come in and they'll be bipolar, or maybe you'll have another one come in and they'll be depressed. You're not only there to help them regain their strength and everything to go back to daily activities, but you're also there as a mental support for them as well.
So some OTA career opportunities. If you plan on just becoming an occupational therapy assistant, your education will be an associate's degree. You'll also need a national licensure and then a state licensure for the state that you're working in. And you would be working in the work environments we talked about before, so hospitals, nursing homes, and then a private practice. But as an OTA, you'll be working under that occupational therapist and taking order from them. If you plan on going to graduate school to become an OT, you'll be working in the same work environments. So again, hospitals, nursing homes, and then private practice. But because you'll be the occupational therapist, you'll have OTAs that work under you. You can own your own practice. You're the head honcho for that.
So basically, as Katie just mentioned, the schooling for an occupational therapy assistant only includes an associate degree and licensures. Now, if you want to move up in the food chain, you'll basically have to go graduate school and get a graduate degree and a licensure for that as well. And then, like Katie said earlier, you will be the supervisor, and then you will have occupational therapy assistants working under you.
So some important skills for an occupational therapy assistant would be active listening, speaking skills, reading comprehension, social perceptiveness, and time management. A lot of these skills deal with your ability to work with people, understand them, talk to them in a way that they need to be talked to. You'll be working with people all day, and all these people are going to be completely different, come to you with different problems, different abilities, disabilities. So the biggest thing is that you're able to work with those people and get along with them, because just like Emily said, they need you for their mental support as well. And if they don't like you, then you're not going to be very good at your job. Time management is an important thing, because you will be busy and you will have multiple patients at a time, and you're always wanting them to get better. You'll just be working with them a lot.
So the wages and growth for an occupational therapy assistant, the median pay is around 2012, so it's been a few years, was approximately in the higher 48,000. But as of 2012, the growth rate for it is predicted to be 41%. So in the year 2022, we're going to have a growth of 41%. So job opportunities are going to be opening up in the occupational therapy assistant.
So some jobs related to the occupational therapy assistant. One would be the occupational therapist, which we talked about earlier. They work over the OTA. Very similar to that would be the physical therapist and the PTA relationship. So you'd have a physical therapist working in maybe a sports medicine hospital, something related to that. And then they have a PTA, just like OTs have OTAs. And those physical therapist assistants are there to assist and help supervise and work for the physical therapist. Another occupation that is very similar to an OTA would be a certified nurse assistant, which are the people that work in the nursing homes that bathe your residents, take care of them. So you're just one step farther than them, and you'd be working closely with those CNAs.
And before we say our we're excited, like Katie said, you're going to be interacting with all types of different people. So not only are you going to need psychology for your patients to keep them motivated to do their stuff and motivated to get better and become more independent, but you're going to be working with all kinds of people as your PTs, your PTAs, your CNAs, because you're going to be close to them every day, because you guys are going to have the same interests. Your patient is what is most important. And so you're going to use all realms of psychology with no matter who you interact